I want to talk about vital sign, vital signs in maternity. Right. But in this video, I'm just going to focus on one of them. Right. In maternity, we have vital sign divided into three category. We have the pregnancy stage, right? We have the labor stage, and then we have the um postpartum stage. So we have the pregnancy stage, the labor stage, the postpartum stage. But in this video, I will be focusing on the labor stage. Right. Other video, I'm going to talk about this and I'm going to talk about this. But today, this is what we are talking about, labor. So the reason why I'm breaking this down is that I like to be so clear with the students, right? Because vital sign is broken down into three parts: the pregnancy, the labor, postpartum. Now, the particular vital sign that you might think is okay here might not be okay here. The one that is not okay here might be okay here. Same for this as well too. Right. That's the reason why this breakdown is like this. Right. So we need to understand. Now, knowing that, so when you are trying to answer your question and then the NCLEX is testing you on vital sign, you want to know if the vital sign is based on pregnancy stage or labor or postpartum. That is how you cannot think about the vital sign. Don't jump into thinking about the vital sign. There is a lot of vital sign to know on the NCLEX exam. Vital sign is not just, oh, your blood pressure is 100 to 120 over 60 to 80, heart rate then will be 60 to 100, and then you say temperature anything greater than 100.4 degree Fahrenheit, pulse oximetry, which is your oxygen, you say 95 to 100, and then you say respiratory rate 12 to 20. No, there are a lot of things that you know. There are a lot of vital sign you need to know. Now you need to know pediatric vital sign. It's on the NCLEX as well too. Right, you need to know pediatric vital sign. Day one, um, let me just write it like this. Day 1 to 3 years, yes. Then 3 years to 17 years, 17 years to 64 years, right? And then 64 to older, right? You need to know vital sign for this, for this, for this, for this. That's how the NCLEX work. Right. You need to know COPD, their oxygen, which is their pulse oximetry reading, because on the NCLEX exam, NCLEX like to most time use pulse oximetry reading, or they might say oxygen level, or they will put O2. Anyone you see, they mean the same thing. Is 88 to 92%. You can see. So same for maternity. The vital sign for pregnancy is, you need to know this. The one for labor you need to know, and the one for postpartum you need to know. Because now, okay, take for instance during pregnancy, if the mother's blood pressure is high, then it's a problem. We are thinking about what, maybe the mother have hypertension during pregnancy, which we call pre-eclampsia. Right. So it's going to be a problem. Labor, you need to understand the vital signs as well to postpartum. Okay, like take for instance now, postpartum, if the mother have low blood pressure, unlike these that have high blood pressure, we are thinking about pre-eclampsia, that's hypertension during pregnancy. But right here, if they have low blood pressure, guess what are we thinking about? We are thinking about hemorrhage. We're thinking about postpartum what? Hemorrhage. Right, you understand? So that is what you need to know. So that's the main reason why I'm trying to break the vital signs for you. Right. So now you understand why we are talking about vital sign in maternity. But remember, we are focusing on what? labor, the vital sign for labor you need to know. There is just three you need to know for labor. Right. There's just three out of the five vital sign. You just only need to know three. Right. It's very important. Now, this is how the question will be like. You understand? Now, you can easily identify that if you are thinking about vital sign, because obviously this question have vital sign right here, and you can see no, this is not vital sign. This is vital sign right here. Now you can see the NCLEX is talking about what? Client in what? Labor. Client in what? Labor. So now you are going to apply vital sign rule related to what? Client in labor, the vital sign understanding based on client in labor. Now, but we are going to find out about that vital sign soon. Now, let's talk about those three vital signs. Now, first one we have O2, which is oxygen, then we have temperature, and then we have respiratory rate. This is the vital sign you need to know for clients in labor. Now, oxygen definitely 95 to 100, nothing is changing. Temperature, nothing is as well changing. Anything greater than 100.4 degree Fahrenheit. But yeah, it's expected for the respiratory rate to be high. To be high. It's expected for the respiratory rate to be high. No value attached. It's expected for the respiratory rate to be high because during labor, um, the mother use a lot of effort during labor, most especially second stage of labor. So due to that reason, the respiratory rate is expected to be high. So when you see on the NCLEX exam and you find out that the mother is in labor, or the lady is in labor, and NCLEX is telling you our respiratory rate is high, it's expected. Right, it's not a bad thing, it's expected. Right, so if you have a temperature that is higher than 100.4 degree Fahrenheit, it's a problem. Right, if you have low oxygen, right, it's a problem. So this is the three vital sign you want to know uh for labor. So now if you look at this particular question, the NCLEX is saying the charge nurse has received a change of shift report on the following client in labor. Now, the charge nurse should ask a staff member to first see a client in. Now, client 1, client 2, client 3, client 4. And then I'm seeing they have vital sign. Then I'm going to ask myself, this is no more than 100.4 degree Fahrenheit. So this patient is okay, out. Respiratory rate is expected to be high. So this patient is okay, out. So my answer will be either between this or this. Right. So now you understand the whole concept, right? So now, one, let's summarize what I said so far, because that what I'm doing in this particular video is just talking about um vital sign in client in labor. Right. So let's summarize. So we talk about vital sign in client in labor. Right. So maternity vital sign is very important. Right. But you want to understand where the NCLEX is asking you about the vital sign. Now, NCLEX can ask you the vital sign related to pregnancy. That would be like antepartum, right? Then it can be during labor, and it can be post what? Partum. Right. So you want to know. Right. As you can see right here, NCLEX stated what? Clients in labor. So now, all what we are thinking about is vital sign related to what? Clients in labor. So now, and I know that uh, we are dealing with this. So to remember, O2, NCLEX can also say pulse oximetry reading, or NCLEX can say oxygen, or NCLEX can say O2. Right, just know that. But the normal range is this 95 to 100%. Right, so just know NCLEX can use pulse oximetry reading. Is that they tell you pulse oximetry reading or the right O2, the right oxygen, they mean the same thing. Right, for temperature, right, anything greater than what? 100.4 degree Fahrenheit. Right, and respiratory rate, it's expected to be what? High. So That is it, right? So that is for labor. So I'm definitely going to make another video. Then I will talk about vital sign in antepartum or pregnancy, and I'm also going to talk about vital sign in postpartum. So watch out for that video.